Hi and welcome. I'm trying to learn medicine, today asthma, and after we're done we're going to do a bit standing yoga. And if you participate in the standing yoga, then it's at your own risk. And this is part 2 already of asthma here. And this is no medical advice, we're just learning about a lot of diseases. And we're talking a bit about internal anatomy and an illness. Now what we already had, that asthma is, now it can be in the first year this wheezing sound because of now bad reason or another reason by young children in the first year, and it doesn't have to be asthma. Asthma can come also as late onset. By older people that can be confused with other chronic heart disease or with other heart diseases, and it can also come after infections of the multiple bronchitis. Most of the times it seems to come during adolescence. Some also didn't, I think. Or in asthma may appear first in the first time in childhood or in adolescence, often after an extension of hay fever. And it runs also a little bit in the family, and it has maybe also something to do or associated with an inflammation of the skin, eczema. And I think those were the most things which we had. Now, but that book is 40 years old, so maybe some things are a bit outdated. Now, symptoms: cawing, wheezing, and difficulty in breathing. The main difficulty in wheeze is related to breathing out and not in. Okay, the main wheeze is hearable when the people breathe out and not when they breathe in. And wheezing is some sort of sound. I don't know exactly, but I think it's a bit like paper. I don't know it. I don't know. Cawing. Okay, next thing. In children, persistent cawing at night may be the only symptom. I think that's interesting. Why is it cawing, especially at night, as the only symptom? Is it not about breathing difficulties? Why does it result when cawing at night? Okay, fast pulse, more than 90 beats per minute, and drawing in of the lower ribs on breathing in. This is especially obvious in babies and young children. Drawing in of the lower ribs on breathing in. Okay, and the lower ribs are drawn in by breathing in. Okay, the symptoms: cawing, wheezing when breathing out, and also difficulty in breathing. Higher pulse with 90 than usual. Cawing at night by children, and drawing in of the lower ribs when breathing. Why? Because that opens the airways bigger, and that helps to, because of the three causes here, the main cause: inflammation. When they are swollen because of inflammation, they are narrowed because of, something said? They are narrowed because the muscles can spasm, bronchospasm, or they can be obstructed by phlegm. Is it just helping, or this is I'm a bit wondering, is it just helping to open the chest more and breathe more into the chest, or has it something to do with was it the diaphragm? What was the name of it? Whatever, the diaphragm, I think was it? That it can work better? Is it because it's just working there, just with the pulse of 90? I think that's interesting. But the most interesting thing is the cawing at night. Why cawing at night by asthma? Must it not technically be the littlest? The least? Because there's resting. Why should there be a problem with breathing? Why cawing then? Now, you notice maybe we are not just here. We're not just here for asthma, learning about asthma. We're learning broadly about all types of diseases and medicine, and also biology and all. Why cawing? What if some things work not so good at night? There are people who have maybe it's other people. There have people that they stop a little bit breathing, and then they wake up again because they have stopped a little bit. But it seems to be something different here. I think it's very interesting. Maybe it's just because I don't know the reason, but causes: respiratory infection may cause inflammation of the tubes. Allergy to certain substances ranging from the house dust, mite to animal fur or feathers and pollens or foods. Now I want to say at that point, I think I heard that there are different types of asthma. Now they say that also the surrounding things can have a cause. So asthma, they're saying a bit runs it in the family, that would be genetic. But they also say already that there can be infections, multiple bronchitis, and allergies against the dust or animals or food or pollen. Maybe we should take a closer look at asthma. If asthma is caused by so diverse different things, from genetic to just a pet, then we should go there and take that more, we should split it up, the disease. I think I heard that there are different types of asthma, but it can't be that we have the same disease, people saying they have it, and they have causes ranging from genetic to a pet. It can't be. Nocturnal attacks in children are often associated with house dust mites, down pillows, whatever, some pillows, or pets sleeping in a child's bedroom. Okay, children can have nocturnal attacks of asthma, and they can have something to do with mites, house dust, pillows, pets, and pets. Anxiety or excitement seems to precipitate mean? Precipitate. Who did came up with that word, and why do people use that word? Seem to precipitate attacks on some people. That's such a complex word to spell it, to write it. It is long, it is difficult to speak. There are so many easier words. Precipitate attacks on some people. And I don't think people use it all the time, actually. There are so much better words. Let's stop having linguistics and come back to medicine. Anxiety or excitement seems to precipitate attacks on some people. Treatment in the home. Both a child with asthma and the family must learn to adjust to the long-term problems of recurrent asthma. What it is, the pet, the pollen, the house dust, or food allergy. Okay, both a child with asthma. Yeah, that's what I mean. If there are so different causes of asthma, we cannot say that is the treatment or that is how to live with it. If there are completely different causes of it. Both a child with asthma and the family must learn to adjust to the long-term problems of recurrent asthma. A child must be encouraged to lead as full and normal a life as possible, yet at the same time be helped and supported to do this by parents and doctors who understand how modern drugs can be used to prevent and control attacks. Now, by saying here that there are drugs, that there are medication, and also should the child be helped and supported that it can live a life as normal as possible with asthma. When to consult the doctor. Mild and transient wheezy breathing occur for the first time in a child should be reported to the doctor. Yes, if there's wheezing sound heard, then consult the doctor. If the wheezing causes distress, if there is cyanosis, we didn't have that yet, but that is if they're talking mostly about a child if there's not enough air supply. So when the fingers get blue, the hands, I don't know to what extent now, but if there's cyanosis, that is not enough oxygen delivery to the whole body. But basically a lot of parts get blue, fingers and lips and ears. So if there's cyanosis, because that means that there is not enough oxygen delivered to the body. Then some parts get blue, the outer extremities, and so that is serious. If there is indrawing of the chest on breathing in, then consult the doctor. Also, if the pulse rate is fast, more than 90 beats per minute. If the wheezing continues for several days, in adults, the doctor should be consulted if any of the above symptoms cause distress or anxiety, or in the event of a sudden severe attack. What the doctor might do: prescribe medicines that can cut short, prevent, or modify sudden attacks and control more prolonged bouts. What it is just the pet, or it's not that easy, but if it is the pet, but if it is a pollen thing, or a pillow thing, or a food allergy? Prescribed medications can be possible, medicines that can cut short, prevent, or modify sudden attacks, control more prolonged bouts. Control any respiratory infection by the use of antibiotics if the cause is bacteria. Okay, that would be bacteria. Okay, whatever. Bacteria. If the doctor suspects that an allergy is responsible, he or she may attempt to identify the substances causing the reaction. If the doctor suspects it. How is it possible? Yes, we can ask, so you have a pet, does it happen then and then? Did it maybe happen if you visited your grandparents, but it happens only there or something like that? But that would be actually interesting. To intentionally go into a hotel for a few days and look at the disappears. Or change completely everything, or whatever, I don't know what's going on. Now, if a doctor suspects that an allergy is responsible, he or she may attempt to identify the substances causing the reaction. It is sometimes possible in adults to reduce the patient's sensitivity to the substance by a course of injections. Children may develop more than one allergy at a time, and it may be necessary to reduce contact with more than one potential cause. Yes, people can have multiple allergies. And then just to take one thing away might not be the thing, because the second thing causing it. Prevention. Asthma cannot be prevented, but the likelihood of an attack can be reduced by taking certain precautions. Do not smoke. I think we mean now in this place also secondhand smoke. Keep out of dusty, smoky surroundings. Seek prompt attention for coughs and colds. And I want to add here again at the end that this book is 40 years old. Maybe there are in the meantime other things found which can cause it. Now that was the medicine part. If you're here for medicine, then go on to the next part where we will talk only about medicine. We will do now the standing yoga. If you participate in standing yoga, then it's better to your arms. We're breathing in and lifting the arms up. We're doing eagle swings. And breathe out, lift the arms down. Again, in the arms up. And out the arms down. Again in. And out the arms down. And lift the arms up. And out to the side. Breathe again in the arms up. And out open to the side. Again lift the arms up. And out and lift them down. Now make an in space between the toes. And breathe in, lift the arms up. And breathe out, open to the side. Breathe again into the middle. And breathe out and sink down into half chair. And come up again. And breathe out, open the arms to the side. Breathe again in the arms up. And breathe out and down. Breathe in and up. And out of the arms down. Now the legs together. We're doing the sheet in the wind. Breathe in, lift the arms up. And breathe out and lean back. Breathe again in into the middle. Breathe out, lean to the side for fur in the wind. Breathe in into the middle. Breathe out over to the other side. Breathe in into the middle. And we're doing the Markor. Breathe out. With your hands down. Draw the shoulder blades together. Breathe in, lift the arms up. I will cross the arms, intertwine the fingers. Reach high, breathe in. And breathe out, reach in front of the back. Breathe in, lift the arms up. And breathe out, the arms down. Draw the shoulder blades together up, just to the sky. Breathe in, and cross the arms. Intertwine the fingers, reach high. And breathe out, reach in front of the back. Breathe in, lift the arms up. And breathe out, we're doing the down hanging dolphin, with it going down. Then breathe in and bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And breathe out and stretch the right leg. Breathe in and change. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. And breathe in. And out and both legs straight. Now we're doing the penguin. Breathe in and lift the right hand up to the sky. Breathe out and bend the left knee and look over the right shoulder to the right hand. And breathe out, the arm and down. Breathe in and lift the left hand up to the sky. And breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in, the arm again down. And out and down. And we're doing the pelican. Make a hand for space between the feet. Shift the weight to the heels. And breathe in and come down. And breathe out, up again. Breathe in again, down. And out and up. Again, in. And out and up. And we don't betray this counterweight. Take out of the elbows and gently swing from side to side. And again down and close the feet. And now breathe in, come halfway up. Straight back on the half lift. Breathe out again down. Breathe in halfway up on the half lift. And out and down. Now breathe in, come up. Close the hands and bring the hands down. And we're doing the sky hugger. Legs solid wide apart. Breathe in, lift the arms up. Breathe out, long arms up to the sky. Breathe again in into the middle. Breathe out, lift again back. Breathe in into the middle. And roll the arms down, close your feet. And breathe in, lift the arms up. We're doing the cactus, connecting with stings. Bring the hands to touch, allow the hands down to heart center. That was Asthma yoga. I thank you very much, and next time.